everyone, and welcome back to Decoding the Digital Lab with CSols. I am your host, Megan Pettyjohn, and today, Becky Stewart and I want to dive into a critical issue that has the potential to derail scientific progress and public health here in the United States, and that is the significant cuts in federal funding to our nation's laboratories and scientific research organizations. Hi, Becky. Thank you for joining us today. As a scientific copywriter and past scientist, you understand how the lab operates and what it needs to keep running successfully. When you hear about these significant funding reductions, what are some of the first things that come to mind for the scientific community?
Hi, Megan. Thanks for having me here to speak about this topic. It is something that might not be making huge headlines every day, but it has far reaching consequences for all of us. Lab professionals do incredible research, from the research breakthroughs we all hope for to crucial disease detection and surveillance, ensuring our food and environment are safe, and providing accurate patient diagnoses that doctors rely on.
You're so right. It's easy to take that vital work for granted until you realize the potential impact these kinds of cuts can have.
Yes, yeah, lab scientists are the unsung heroes behind so much of what keeps us healthy and informed. And many of them are now facing an uphill battle with widespread eliminations of federal funding and personnel. It's not just one agency either. We're talking about the Department of Health and Human Services, the NIH, the CDC, the EPA, the FDA, some of the most vital organizations we have. Cuts at the federal level don't just stay there either. They create a ripple effect, impacting labs in every corner of the United States and even beyond our borders.
Yeah, so today we really want to unpack the direct and indirect repercussions of these cuts. We think it's crucial for everyone working in a lab and for the organizations they're a part of to understand what these changes mean so they can start thinking about how to respond and how to try to do more with less. So let's start with the direct impacts on research laboratories. What are we looking at there?
Well, one of the biggest hits is going to be the gutting of fundamental research due to the loss of NIH grant funding. Those grants, as we know, support a lot of the higher risk long term research at universities, the kinds of studies that might not have immediate payoffs, but are the very foundation for future scientific breakthroughs.
It's almost like eating the seed corn, isn't it? Like you have to have extra food now, but you're jeopardizing future harvests.
Yeah, exactly. And the potential consequences are dire: blocked scientific progress and ongoing research that grinds to a halt, delays in new projects, and even a brain drain as researchers feel they need to retire or go to countries with more stable funding environments.
Which areas might be hit the hardest?
Well, for sure, basic science research of all kinds, translational research that's trying to bring lab findings to patients, and even specific disease focused initiatives like HIV research. A lot of this work is done at universities, and the indirect costs, the overhead, were often heavily supported by NIH grants. That's things like grad student salaries and consumables. Now, the plan is to limit reimbursement for those costs, which is going to put a huge strain on those institutions and make them rethink what they can support.
And it's not just about the research itself, is it? What about the physical labs?
Exactly. It's important to recognize that potential cuts to infrastructure and equipment funding will happen. When budgets get squeezed, things like upgrading lab equipment and software are often the first to go. That's going to lead to efficiency losses and more downtime on essential instruments, and ultimately limitations on what research labs are capable of doing. Optimizing the systems we already have is becoming so incredibly important.
So that's the direct hit to research. What about the indirect repercussions, particularly for clinical and diagnostic labs?
Well, one major area is public health. Agencies like HHS used to be a big source of funding for public health labs and research. So when those budgets are slashed and the burden is kicked back to the states, it weakens our ability to respond to public health threats. Think about disease outbreaks or even monitoring things like those forever chemicals in our environment. Microbes and molecules don't respect state borders. Less funding means fewer resources for the labs on the front lines.
Yeah, and that has a direct impact on our ability to protect the public.
Absolutely. Then there's clinical research. NIH funding has also been a big supporter of clinical trials, the research that directly impacts patient care, like advances in cancer treatment. These cuts will inevitably lead to fewer trials, and down the line, that means reduced access to new diagnostic tools and treatments for patients.
That's a really scary thought. What about people actually working in these labs?
Yeah, laboratory capacity and staffing are already being affected. Public and nonprofit clinical and diagnostic labs are facing real constraints. Adequate staffing levels and abundant resources are likely to become a thing of the past. We all should prepare for increased workloads on existing staff, potential hiring freezes, longer turnaround times for critical tests, and an overall reduction in the quality of service these labs can provide.
So it's like a perfect storm of less funding, less equipment, and potentially fewer people to do the work.
Yeah, exactly. And the impact goes even wider, leading to some significant economic and societal implications. Think about innovation. University research has been the bedrock of the biotech and pharmaceutical industries for years.
Yeah, we're seeing impacts right here in Delaware, where CSols is headquartered, as funding cuts affect key innovation centers. Similar losses in STEM innovation will be felt across the country. And that could also have long term consequences for our economy. Won't it also add to health disparities?
Yeah, sure. Historically, underserved populations have faced challenges accessing quality health care. These cuts to research on the health issues prevalent in those communities are going to make those disparities even worse.
That's a really important point to consider. And finally, we need to talk about our global competitiveness. The brain drain that's likely to happen as researchers look for more stable funding elsewhere will have a huge impact.
Yeah, I've seen a poll suggesting that a large percentage of scientists are considering leaving the US. That's going to blunt our competitive edge in scientific research and development on a global scale. I also have scientist friends in public service who are now retiring relatively young, so they don't have to deal with those changes.
So we're painting a chaotic picture. What are some of the meaningful steps that laboratory professionals can take in the face of these cuts?
I can't overstate the importance of staying informed about the ongoing changes at the federal level. Talk to your congressional representatives and make your concerns known. Congress people always say that these constituent calls and letters really are effective.
Well, that's good to know. What else?
Read the president's discretionary budget request that came out on May 2nd and reach out to your representatives again if programs you care about are underfunded. You can advocate by joining professional organizations and adding your voice to theirs, and raise awareness within your own institutions and communities about the potential effects of these funding cuts.
Where can our listeners find information about this?
You can find information for your state online at usaspending.gov.
Okay. And we'll put these links for these resources in the episode summary for our listeners. All right. So it's about being proactive and making your voice heard. What about collaborating with other labs in your field?
That's a great way to make lemonade, so to speak. Sharing resources and looking for grant funding from nonprofit organizations that support scientific and medical research.
Well, as we end this episode, can you offer advice to help our listeners maintain excellence in their labs while they navigate these changes?
Sure, let's end on a positive note. Although there will be significant challenges ahead, there are also opportunities with greater efficiency and innovation. take the time to look for those opportunities. It's a tough situation, but awareness and proactive engagement are key for laboratory professionals right now.
Well, Becky, thank you so much for sharing your expertise with us today on decoding the digital lab. It's been incredibly insightful.
My pleasure, Megan. It's a critical conversation, and I hope it empowers our listeners to take action and advocate for the vital work they do.
That is all the time we have for today's episode. Join us next time on Decoding the Digital Lab with CSols for more insights on the world of laboratory informatics.